Once school starts, parents know it's only a matter of time before their child comes home sick with a cold. But that virus can actually be something even more alarming. KETK's Nikki Diaz is live in the News Update Center to tell us why this so-called common cold has some children in the hospital.
Casey, between 800 and 900 kids across the U.S. have visited hospitals with symptoms of the D68 respiratory illness. Some of them have even ended up in the ICU on breathing treatments. So what's the big deal with this cold?
And this is picking on the kids who already have a diagnosis of asthma or have wheezed before. So it's a lower respiratory infection that's bringing kids into the hospital. And apparently at an alarming rate, it's also causing them to go to the ICU for respiratory failure.
Doctors don't have a vaccine for the virus, so children going into the hospital, and especially those in ICU, are having to get specialized care.
They develop respiratory distress, and if their work of breathing increases at the place where they can't support their own ventilation, they get put on a breathing machine and stuck in the ICU. So they get a ventilator treatment until their lungs are better, and then they go home.
Doctors have some tips on how you can stay healthy, and it's probably something you already know how to do.
Hand gels are great, hand washing is great. If your child's old enough to be reminded not to put their fingers in their mouth, nose, and eyes, most things are spread that way. To cover your cough, coughing in your sleeve. If you can cough in your sleeve, it makes a huge difference.
And Dr. Rogers wants to remind parents of children with asthma to be proactive.
If your child is supposed to be on a controller med, one of the inhaled steroids, this is a great time to restart right now. So if they're on that controller med, when they get any kind of upper respiratory virus, they're less likely to get severely ill.
The sickness has spread through 10 states so far, but there have been no confirmed cases in Texas, although Dr. Rogers says he did see 2 patients with high fevers and wheezing the other day, and it could just be the beginning. Reporting live in the News Update Center, Nikki Diaz, KETK News.
Hopefully not, Nikki. Thank you.